Now we're going to spend some time discussing the musculoskeletal system. The musculoskeletal system is made up of our bones, our skeletal muscles, tendons, ligaments, and joints. And they all function together as the mechanical basis for movement. So we'll start off by discussing bones. Bones protect our internal organs. The skull protects our brain. The rib and sternum protect our heart and lungs. So bones have a protective effect. They also provide shape. They provide a nice frame to keep our body supported. And movement. So the bones, the skeletal muscles, the tendons, ligaments, and joints all function together in the healthy person as the mechanical basis for movement. Our bones are also a mineral reservoir for our body, so our bones store calcium and phosphorus and magnesium. And our bones are also responsible for blood cell production. So the marrow that is located within the medullary cavity of long bones produce blood cells in a process called hematopoiesis. In the long bones, here's an example of the femur. This red marrow in the center of the medullary cavity produces red blood cells, the white blood cells, and our platelets. And this is mostly in children. In adults, the medullary cavity becomes filled with mostly fat tissue or adipose tissue. We see some examples of long bones of the body. The humerus is a good example, and so is the femur and the fibula and the tibia. And these bones are characterized by epiphyses at each end, and these wide epiphyses of the long bones allow for greater weight distribution and help keep our joints stable. Every joint comes with a natural shock absorber in the form of cartilage. And it's a firm, rubbery material, and it cushions the ends of the bones, and it reduces the friction in healthy joints. The other thing we want to know about cartilage in our joints in general is that they don't really have a very intricate blood supply. And so nourishment to the synovial joint capsule comes mostly from the synovial fluid. And that will have some meaning for us a little bit later when we talk about disease process. Ligaments connect bones to other bones to form a joint, and tendons also connect our muscles to our bones. So ligaments connect bone to other bones, and the tendons connect muscles to bones. So an example of a ligament is the anterior cruciate ligament, and it connects the femur to the tibia in the knee joint. And so you'll hear of folks that have an ACL tear, which means they had a tearing of that ligament, and this can be very painful and very debilitating. So let's talk a little bit about a sprain. A sprain is actually defined as of overstretching of the joint with tearing of a ligament or tendon. In a strain, we also have an overstretching or tearing, but this is generally defined as the tearing or overstretching of a muscle or a tendon. But a ligament can also be involved in a strain as well. So here we can see a picture of our bone and our tendon that's connecting our bone to our muscle, and know that in a strain, the tendon or the muscle can become overstretched or torn. Okay? So what do we do about it? The nice thing about sprains or strains is that we treat them the same. We want to avoid activities that cause pain to the injury. All right, so we definitely want the person to rest and not do whatever it is, the motion that causes extreme pain to that injury. We want to ice that sprain or strain for about 20 minutes at a time for every 3 to 4 hours. So this is for the first 48 hours after our sprain or strain. We want to ice it for 20 minutes at a time every 3 to 4 hours. So we can remember RICE, which is a good acronym to remember how to treat a sprain or a strain. And R stands for rest, I stands for ice, compression is the C in RICE, and elevation is the E. So compression with an ACE bandage after a sprain or strain, along with elevation, may reduce swelling. Okay, and the compression with an ACE bandage is also going to provide a little bit of stability for that joint area that has been sprained or strained. In the case of a sprain or a strain becoming a tear, and we need to diagnose that, the patient may go in for a test, a procedure called an arthroscopy. Okay? And in an arthroscopy, stab incisions are made into the knee through which a scope and an irrigation cannula will be inserted. And this irrigation cannula will inject air or fluid into the joint space, and the arthroscope allows the surgeon with a tiny camera to view the joint in its entirety in order to make a diagnosis of its condition. The other important thing about arthroscopy is that it can be used, of course, we just said for diagnostic purposes, but it can also be used to repair the torn ligament. And so what the surgeon would do is grind away the unhealed edges of the tear in order for healing to occur. So what happens sometimes is there's an injury to the soft tissue, to the ligament, and there is scar tissue that forms. The ligament does not heal properly. And so with arthroscopy, the surgeon can go in, can scrape away the scarred tissue, and new tissue, healthy tissue, can regrow. Bursa are the fluid-filled sacs in our joints, and they help reduce friction between our bones. They're located in all joints of the body. So if you hear of someone who has been diagnosed with bursitis, this is inflammation of these fluid-filled sacs. And here are some examples of some bursa in the knee, all of the areas that are highlighted in red. And so these provide a cushion between the bones and the tendons around a joint. Bursa are filled with synovial fluid. So now we're going to take a little bit of time to talk about muscle. So our muscles are the fibrous, dense tissues with the primary function of allowing the body to move by repeated contraction and relaxation. Muscle also helps maintain our posture. Our muscles aid in stabilizing our joints, and our muscles are also essential in glucose regulation. So when insulin is secreted by the pancreas, increased insulin levels in the blood signal our muscles to store glucose. And when the opposite hormone, glucagon, is secreted, then our muscles are stimulated to release glucose. So there are different types of muscles. Striated muscle is also known as the skeletal muscle because it is responsible for the mobility of the body and limbs. And these are voluntary muscles. So here we can see some examples of our skeletal muscle, our deltoid, our quadriceps, our biceps, our abdominal muscles, and all these muscles are voluntary. That means that I will my arm to move and my leg, and these are voluntary movements. However, there are also involuntary muscles, and a cardiac muscle cell is an example of an involuntary muscle. That means that the heart muscle cells beat on their own without any input from me saying heartbeat, right? This is an involuntary muscle contraction. The voluntary muscle we just talked about is the skeletal muscle cell, and then we also have involuntary smooth muscle cells. And the smooth muscle cells are usually located on the walls of the hollow structures, for example, in the GI tract and in the bladder. And these are also involuntary muscle cells. So, to sum up a little of what we've been talking about, again, we've kind of discussed the healthy body with healthy bones, skeletal muscles, tendons, ligaments, and joints that function together as the mechanical basis for movement. So, patients that have diseases of the musculoskeletal system will have problems with mobility. And as the nurse, one of our biggest concerns for these folks can be immobility and pain. So we're going to spend a little more time talking about joints and defining the different types. So a joint, the definition of a joint, is the point where two or more bones meet. And there are three main types of joints. First, there are fibrous joints, and these joints are immovable. Okay? So an example are the coronal sutures that hold together our cranial bones of the skull. So this joint is actually a place where two bones meet in the skull, but it is immovable. Okay? And so this is a fibrous joint. A cartilaginous joint is a partially movable joint. So the connection between the bones is made up of cartilage, and there is partial movement. An example is the intervertebral discs, our cartilage that keeps the bony process of the spinal column together. And we can move, if we move back and forth, we can move our spinal column. Then there's the synovial joint. Normally, synovial joints provide free movement between the bones that they join. And synovial joints have a capsule. They have an outer fibrous layer and an inner synovial membrane. And we refer to this inner synovial membrane as the synovium. So here we can see the knee joint, and we see our articular cartilage at the ends of our long bones. Okay, we can see the tibia and the femur and our cartilage meeting where the synovial membrane is. And then we have our knee bone, our patella, and you can see where the synovial fluid is, and the synovial fluid actually bathes the joint. So a fibrous capsule that's not pictured here until we kind of drew in that picture for you is the capsule that surrounds the joint and keeps all of these pieces into place. So synovial fluid fills the joint cavity, and it provides lubrication, and it also provides shock absorption. So now we're going to discuss types of synovial joints. There are several types. However, we are only going to discuss three. We are going to talk about the hinge joint, the pivot joint, and the ball and socket joint. So joints are often characterized by the type of movement that they allow. And so here we see the knee and is a good example of a hinge joint. And so the motion that the knee allows is that of flexion and extension. And so when you think of flexion, I want you to think of decreasing the angle between two bones, okay? And when we think of extension, we are increasing the angle between two bones. So an elbow is another example of a hinge joint, and again, these joints permit flexion and extension. A pivot joint, example is C1 and C2, where a rounded process of bone rotates within a ring composed of a bony fossa. And so to rotate around a central axis is what I'm showing you here. Okay, so I'm using my pivot joint, my C1 and C2, to rotate around a central axis.